happy to answer how we screen for the non-invasively for pudendal artery blocks. Mic दे दूं उनको? Okay, time I know. Okay. लो वायर दिखाओ. I'm only not too sure whether this kink would allow the wire to and the balloon to go and the stent to go. Okay, give me a shot. This is a RCA guiding catheter, cordis, show me, caudal, RAO caudal, LAO caudal. Yes, you can actually. No, go RAO caudal. Okay, plain करो. Show me. Show. Okay. Show. No. Yeah, this is a whisper wire. Show me. Okay, I'll probably change the angle on this wire and get me a stent on this. 4 into resolute. Okay. Get me a torquer. This is a 3.5 millimeter vessel. We can use a bare metal stent, but I'm thinking of putting in a resolute, especially because he's a diabetic patient. दिखाओ. Yeah, that is the anterior trunk of anterior where, yes. Check करो. Don't give so much of contrast. Yeah, I almost made a J curve. Anyway. I think we are in some other branch from the top. Check. Angulate करो उसको. I almost made a J curve here. Dr. Kapoor?
You'll have to give me I can't hear it. You have to give me your earphones. They only have.
He's just answering that. The question is there some easier way to do without giving intracavernosal injection of piperine? Sham दिखाओ.
No, we have got another cavernosal stimulant called Caverjet, which is a prostaglandin, and it's a less painful injection. Though of course the piperine also is not extremely painful if it is done properly, but we prefer using piperine or using Caverjet.
जरा इनको mic दो. इसको बुलाओ.
Mic. We actually prefer using piperine or using Caverjet. The results are slightly better with Caverjet, though Caverjet is not easily available in India and has to be imported.
Get me another all-star wire.
So
All-star.
using the
Get me an all-star wire.
or using the oral agents to increase the penile blood flow,
ऊपर दिखाओ.
our experience has not been that good.
ऊपर.
So we still prefer
Upar.
injectable method of diagnosis.
इनको दिखाओ ना. इसको बोलो बुलाओ. दिखाओ नीचे.
I think they have only one.
Get me another wire, all-star wire. Mila? I think I'll use another wire. It's probably going into some other branch. क्या कर रहे हो? Don't fool around here. Yeah, if I don't get it, then I will do it. But I'm using another wire maybe, and a non-hydrophilic wire.
तो ये माइक है. माइक है ना? Okay.
Sometimes it becomes really, this is not very tortuous, but getting into the internal pudendal becomes very difficult. You pulled out the wire, sir. लाओ.
हेलो.
ऊपर दिखाओ.
बस निकल रहा हूँ 2 मिनट में.
आओ.
हाँ, रिपोर्ट भी साइन
ठीक
करनी
है.
है और वो
Give me a 5 French or 4 French diagnostic catheter. Four French thermo catheter. दूसरा ले लो. There is a kink. जल्दी से बोलाओ. Wire. Get me a thermo wire. Be fast, yeah. Not pull wires. Okay. So now we have taken a 4 French thermo catheter and a thermo wire. There is a kink. We want to cross this and selectively intubate that artery. Take that out. Take that out. Just okay, नीचे दिखाओ. Hold this. Hold on. दिखाओ. Yeah, that would normally do it very well, but you know, I thought, I know. Show me. If check. I wire. Whisper. Whisper wire. Mm-hmm. No, there has been no paper on that. No, nothing. No paper on that. But you know, doing physiological testing with this, the papaverine, intracavernosal injection of papaverine, and many a times it is even done on the table. And if you find no other lesion, then I think this lesion is significant and we should do it. Torker. जल्दी करें. Should be fast. थोड़ा सा मुझे एंगल दो इसमें. check. दिखाओ. Yeah, that is what I said. The first thing is you have to, by a penile Doppler, I heard the question. We exclude the venous disease by doing a penile Doppler and ruling out a venous leak. That is the most important thing. And if that is more common than this, and if that happens, we should not take these patients for an angioplasty procedure. Okay, can I have the stent now? 28 दे दो. 28 दे दो. So we have passed our wire into the anterior trunk of internal iliac. Internal pudendal artery is a branch of this. And now we are going to take 3.5 into 30 millimeter Endeavour resolute stent and place it here. And we believe this should improve the functions. And Dr. Kapoor is going to do a penile Doppler after that, maybe after a few days, and then see, because right now the patient is anticoagulated, and then see whether the patient, the penile flow has increased or not increased. Hold. Connect. No.
I don't think so. Plain penile Doppler, I don't think has any role.
Can you hear
Because,
Dr. Kapoor?
because that only gives you a baseline study. It might show that the flows are not that much damped as they were seen earlier, but basically the real thing would come if you actually give an intracavernosal papaverine.
Normally, normal resting penile
Maybe you could, yes. I think it's not a bad idea to actually compare the two. And we don't have that much of experience of immediately doing the penile Doppler study after this procedure. So I think what we can do that we can do a plain penile Doppler and see whether there is any improvement in the rate of rise of the peak flow velocity. The peak flow velocity normally has a rapid acceleration. In this particular case, the acceleration was rather slow, indicating that it's a damped flow. So in this particular case, if we can show that the acceleration increases, then probably the results are going to be good. But I think it has to be compared afterwards when we do the regular penile Doppler study using intracavernosal papaverine.
Okay, go up. Go up. 2468. 9, 10, 10, 11, 12, 13. Save. Deflate.
Yeah.
Save that. Okay. So we have put a 3.5 into 30 millimeter Endeavour resolute stent. Can I have a DSA on this? Ready? So looks okay. Hello? Do you think we need to? Yeah, let's give him a try and see his penile blood flow in 2-3 days and whether he responds or not. But this is just an anterior trunk angioplasty. But I was suspecting that we will have pudendal artery tight stenosis, and that's more interesting, where you go with smaller wires and you go with smaller balloons, much smaller balloons, and sometimes. Yeah, sure. नीचे से दिखाओ. Let me take out the balloon. Sure. No, with DSA. 1 minute, sir. Okay, give me some nitro. Okay, I'm going to give you. Okay. Oh, okay, non-DSA. Ready?
So they're going off, I think.
Okay. This is the Pudendal artery now. I don't know what you make out with the flow. You need nitro? Looks little better, but maybe it's more of a.
Subjective appearance.
It's. I mean, the best way to what we do in our follow-up is to see the penile increase in the penile flow. Looks more. It's getting more filled now, but and I think there's every reason for it to look more filled up now. Let's do a DSA. That would give us a better picture if we have time. Okay. Nitro. Okay. Get to a DSA. Yeah, up till the Pudendal artery, distal. Okay, keep it here. ऊपर दिखाओ. ऊपर दिखाओ. Okay. Here. Ready? So this is the DSA, which looks better. You can see now the Pudendal is filling up well. Okay. Thank you very much.